Hi guys, this is Dr. Bhupesh from Dr. BKM Institutes once again for you all, and please subscribe our channel for the best OET sample videos. If you have not, do subscribe the channel right away. And our contact number is +917696734256. For the best OET coaching, you may contact us on this number. Yeah. So today we are going to discuss the listening session. We normally do not do listening, and even I am trying listening in front of you guys. I have not done this listening. I don't know whether it's easy or difficult. I'm just gonna find the way out. And the people who have been following us for a long time on our YouTube channel, they know elimination is the method that I follow for reading and listening part B and C. Let's see whether that method is applicable on this listening or not, or whether this listening is good or not. Because sometimes in OET, material is not up to the mark, and I don't know whether this listening would be. But thanks to an institute who has created this question paper, again being Dr. BKM OET Institutes, we love to teach you how to do things. So I have not done this listening before, but yeah, we'll try to catch up. Let's see how it is. So first of all, what I do, so it's 25 to 30. These are questions of the part B, and part B obviously is somewhat easier than part C. So if we can do part C
stages
well,
while having to do.
if we can do part C well, then we can do part B anyhow. So I'm just going to take it forward.
Yes. The patient seemed for the very.
Okay. So now part B is about to get over. That is why there is a pause in the noise. And taking it forward. Yeah. So
Now look at part C.
That is the part C. Thanks to OET 2.0 online classroom again. But the main thing is how to do it. And that is where, we love taking these challenges. You hear an ear, nose, and throat ENT specialist called Dr. Cynthia Davison, giving a presentation about the causes and treatment of nosebleeds. Always read the topic carefully. That today the topic is of nosebleeds, and the surgeon is ENT surgeon. Obviously, you have 90 seconds to read the question. So these 90 seconds, sometimes people take it for granted. No, these 90 seconds are very, very crucial for your listening part C. Very crucial, because you can understand the whole topic. So you will read the question first. Dr. Davison thinks that the health service would benefit from. So again, Dr. Davison means ENT surgeon thinks that health service would benefit from. How can health services get the benefit? First of all, understand the question. Now, second question. So read all the questions only. Dr. Davison feels the main problem with what she calls artificial air is that. So artificial air is the second word, and the main problem with artificial air is what? So first question was health services benefit, means the tone of the question was positive, and this is talking about the problem, main problem. That means the tone is negative. Main is a very important word. There can be many problems, but we need to trace the main problem, and artificial is the word. Then you go to third question, means in the final exam you can underline these things. Underline this, would benefit from. Never ever miss preposition in readings and listening. Even in the part A, prepositions are very, very crucial. From word is very important over here. So here is that when discussing causes, Dr. Davison suggests that nosebleeds may be. So causes mean maybe because of hypertension, because of organ failure, maybe because of allergy. So this is the question, but I normally do not read kind of options, because it makes you have lot more statements. You want less statements in your mind, otherwise you will get confused. So question number 1, benefit, health services. Second question, main problem, artificial. Third question, cause of nosebleed. That's it. What common problem associated with the nosebleeds are a cause of particular concern? So what is the particular concern? So particular word, main words are very, very important, because there can be many concerns, but we have to find a particular main concern. So what common problem associated with the nosebleeds, common problem associated with the are a cause of particular concern. What reservation? Reservation is a very typical word. Reservation means limitation. Limitation means drawback. It's a negative word. What limitation does Dr. Davison express about the use of silver nitrate pencils? So maybe for the treatment, silver nitrate pencils can be solution, but what is the reservation? Means what is the drawback? What is the disadvantage? So the tone of the question is negative. So normally I say eliminate the word only. Normally I always say only word should be eliminated. But in this case, when we are talking about a negative thing, only word can be very good word to choose. Because if I say what is what is the problem with Apple phones, or what is the problem with Android phones, or what is the problem with iPhone? iPhone, the only problem is that it only uses its own software. Means it is not like Android that can be used in other mobiles like OnePlus, Oppo, Samsung. So the only reservation of Apple is that it has its own software. So only word can become a very special. So that is why when I always teach you reading, when I tell you about the concepts of reading, yesterday I forwarded you the video where I told that adverbs adverbs means words like only, fast, exclusively, hardly, barely should be eliminated. But when you are talking about the negative question, only word becomes very special. What point does Dr. Davison make about the use of Goj packs? Now you have 6 statements in your mind, and now in the exam try to remember the statements. First, health benefits means health service would benefit from what thing? Main problem, artificial air, nosebleeds cause. This question is very hard, but again, we will do on the way. This question was hard to remember because it's a big statement. Common problem associated with nosebleeds are a cause of particular concern. Hard statement. Don't try to remember it too much. We will do it on the way. What reservation? Negative thing about silver nitrate pencil. Negative thing about silver nitrate pencils. What point does Dr. Davidson make about the use of Goj packs? Goj packs. So these are the words. So by this time, I'm teaching you at the moment, I'm explaining you things, but if I am alone, I can do that in 30 seconds and you might do that in 40 seconds. So you still have around 50 seconds to read question number 1. So after you read, after you understand what my topic is, so I understand the topic of today is nosebleeds. There are questions talking about the problem, talking about the causes, talking about silver nitrate, talking about Goj packs. I can remember a lot of things now that you have to remember. This is what you need. And you can underline in the exam. I am not underlining over here, but if it's my exam, I would be using this. Yes, I would be using this. So I will underline this word. Then I will underline this word. Main problem, main word is very important for me. I will keep a note of it. Then artificial word is important for me. Discussing causes, maybe because of this should be the easiest question, 33. But again, you can't guarantee, but 33 I feel that should be easy. Then associated particular concern, particular word is very important for me. Then it comes to Dr. Davidson expresses about the use of silver nitrate word, and reservation word is very important for me, and the use of the Ghost packs. So these are the words I would like to underline if it's my final exam. All right, now I will go to the listening session. And by the time listening will start playing itself. So you have to be ready for that. And I have to be ready for that as well. So I'm just going to play it. And by the time I would be reading first question, Dr. Davidson thinks that now I should know all the 3 options. Health service would benefit from reducing the time that patients with the nosebleeds spend in the hospital. Again, every word is important. Reducing the time in the hospital, reducing the time of patient in the hospital, devoting more financial resources means giving more money, or discouraging people from seeking unnecessary treatment. So let's see what is the reason. So now by the time they will start playing listening, I should have read at least first question and all the options. So I've read first question and all the options. By the time it will automatically start playing in the final exam. So let me take it forward. I'm taking this forward. Oh, it's not saying anything. Yeah. See,
Good afternoon.
this is the time you get 90 seconds. You have a lot of time to read questions to understand your topic. Now she will start speaking.
Dear Davison, and my presentation will focus on the causes and treatments of nosebleeds and the implications for those of us working in the health service.
By the time she is speaking, I am concentrating upon health services will benefit from reducing the time in hospital, discouraging people from seeking unnecessary treatment, devoting more financial resources. So I will keep on reading again and again.
About 60% of people get nosebleeds at some time in their life, particularly children and old people. Most of these events resolve spontaneously, and the mortality rate from nosebleeds is extremely low. But
Now, whatever she is speaking, you should not hear that very carefully. Because till the time benefit word not does not come, you keep on repeating those options in mind. Like by the time she is speaking, I am repeating again and again. Financial, reducing time in the hospital, discouraging people from seeking unnecessary treatment. So I'm repeating it again and again that we should discourage people, we should give financial resources, or we should reduce the time. So I'm again and again repeating
treating
that.
them still costs the health service a lot of money. In my own hospital, over 40% of admissions in ENT involve nosebleeds. Ideally, we treat many of these as outpatients, yet the majority of those patients will stay in for 5 days. Last year, in my department, €250,000 was spent on the management of this condition. Clearly, any saving on that, if duplicated in hospitals across the country, would have a positive impact on resources for other services. The biggest
So now I think what she has talked about is that there is lot of money that is being spent. So that means she does not want to devote more financial. That is what elimination is. She wants to reduce the expenditure. She does not want to devote more financially. At least B is eliminated. That is what elimination is. B is eliminated as far as I think. I don't know the answers, but I'm doing it in front of you. We will check the answers later on. I am playing it again to tell you what is elimination. I will
stay in for 5 days. Last year, in my department, €250,000 was spent on the management of this condition. Clearly, any saving on that, if duplicated in hospitals across the country, would have a positive impact on resources for other services.
So would have positive impact on the resources of other services if you can reduce the financial resources. So that is what she wants to reduce. And second thing she said that time spent in the hospital is 5 days. So she also wants to reduce the time of the patient staying in the hospital. Until now, A is my answer, but let's see how if there is any other line she speaks about.
The biggest enemy of the nosebleed is artificial air. In hospitals, we get an
So straight away she has come to artificial air. Sorry, I do not know answers and I do not do listenings on regular intervals. So I would like to take your help in the first answer. So according to me, answer should be A. You can let me know it is wrong or right. Then I can go forward. Otherwise, I should not check the answer if I am a daily person. But when I'm doing listenings not more often, then obviously I need to ask you. So 31st A is fine.
Yes, sir.
Fine. So easy question. Again, I will play it for all of you again. See. So please understand, she's saying patients spend 5 days in hospital. So if you do that thing, then you can reduce the money. So that means financial resources she wants to reduce. She does not want to increase. So that is what any elimination does. And then you reach to A. C is not being eliminated, but C is not being talked about as well. So C does not is not hurting me at the moment. So A is it should be my answer, and you have told me it's right. So I will make you listen to it again.
Last year, in my department, €250,000 was spent on the management of this condition. Clearly, any saving on that, if duplicated.
So any saving on that means she wants to save that thing. She wants to save money. So B should not be. That is what elimination. Again, I'm telling you, learn this method. You will have a very good time with reading and listening. You will never ever have any problems.
Hospitals across the country would have a positive impact on resources for other services. The biggest enemy of the nosebleed is artificial air.
So now my keyword has come, artificial. The biggest problem means main problem. So feel that main problem with what she calls artificial. What is the problem with the artificial air? Now she would be speaking and I would be reading the options.
Hospitals, we get an awful lot of older people coming in with nosebleeds in winter months. As you'll know, such patients don't tolerate the cold for various reasons. So they tend to sit beside radiators and heaters, and these dry up the air. This means the cilia, which protect the lining of the nose, dry out, and this in turn exposes the blood vessels, which causes bleeding. Our noses haven't developed a defense mechanism.
So again, it was a hard one. If I do it in the first round, obviously it's a hard one. It's very hard for me to do. But I think she talked about temperature. She talked about dryness. So what artificial air does, she was saying that it leads to dilation of blood vessels, or B can be my answer, because she was saying I will make you listen again, but I can feel it's B or C, most probably C, but I'm not doing it as a final answer. I would like to listen to it again because I need to tell you how to do it. So I will listen it.
Saving on that, if duplicated in hospitals across the country, would have a positive impact on resources for other services. The biggest enemy of the nosebleed is artificial air. In hospitals, we get an awful lot of older people coming in with nosebleeds in winter months. As you'll know, such patients don't tolerate the cold for various reasons. So they tend to sit beside radiators and heaters, and these dry up the air. This means the
So what is happening in the cold winter days with the old people? They sit with the radiator or heaters like we are doing these days. Because of the winters, we are sitting beside the radiator, we are sitting beside the heater that dries up the air. That is what is artificial air. Artificial air is thrown by heater. That is what they are talking about. So what artificial air does,
Such patients don't tolerate the cold for various reasons. So they tend to sit beside radiators and heaters, and
they cannot tolerate cold because they are old, so they sit beside. Please try to learn, and that is why I say do one listening 3 times. Don't do 3 different listenings. If you can do 20 listenings 3 times, you are ready for the exam. If you do 60 listenings one time, you are never ready. You will never be ready. This is the most important thing you need to learn. You keep on doing other listenings. Do one listening 3 times. 20 listenings will help you pass. You don't have to do 60 listenings, but do it 3 times. Do one listening, same listening 3 times. Same listening 3 times. That is the way to learn. If you want to learn, you need to listen to it again and again, like the way I am doing right now.
dry up the air. This means the cilia, which protects the lining of the nose, dry out, and this in turn exposes the blood vessels, which causes bleeding. Our noses haven't developed a defense mechanism.
So basically, I think answer should be B. Because why, I don't know. I will let you know. First of all, I would like to know the answer, but reason I will give you, there are 2 reasons of doing B. Otherwise, C can be also answer. I am doing B because she is saying it is too cold in winters. So she's not talking about artificial air. Artificial air is thrown by heater and radiator. So heater and radiator will not throw the cold air. So A is eliminated. A is eliminated. Too low in temperature. Low in temperature means cold. Artificial air means coming from the heater. Heater air cannot be low in temperature. So A should not be my answer. Again, elimination. Now, even if I put a speculation or a guesswork, then B or C, at least 50% I have the chances to be right. Then second point, she was saying that it is a dry air. So it contains low levels of moisture. Dry means low level of moisture. Again, vocabulary difference would be there. And third, why did not I do C? Because she is saying that there will be exposure of the blood vessels. She is not saying dilation of the blood vessels. That was the reason that I eliminated A and C. But these people can, I don't know, I should not say these people. Means listening is a tough job and you can never be sure. Even reading you will never be sure, but elimination helps you to reach to the answer. So again, I'm making you here. Before I ask you the answer, I again will make you here. Heater cannot throw the cold air, eliminated. It can lead to dilatation. She's not talking about dilation. She's talking about exposure of blood vessels. Let's
A lot of older people coming in with nosebleeds in winter months. As you'll know, such patients don't tolerate the cold for various reasons. So they tend to sit beside radiators and heaters, and these dry up the air. This means the cilia, which protects the lining of the nose, dry out, and this in turn exposes the blood vessels, which causes bleeding. Our noses haven't developed a defense mechanism against artificial air. 300 years ago, everybody lived in drafty houses and cold environments. Now we all sit in heated rooms, and the nose hasn't adapted to this. The evolution of an organ can take millions of years, in fact. The immediate cause of a nosebleed can be local trauma or inflammation caused by a simple cold, but systemic diseases have to be ruled out in all adults presenting with the condition.
So I don't think so. She's talking about dilation. She has talked about inflammation, so can be dilation. But again, that is what I'm saying. You can never be 100% sure of your answers when it comes to reading and listening. You have to put a guesswork. And when you practice more, you become better at it. So if you can help me with 32 question, C or B? B is my choice.
Sir, B.
Done. Everybody is okay until now with 2 questions. Can you learn elimination method?
Yes, sir.
So what did I eliminate in the first question? What was the main elimination? Financial resources should be decreased. She wants to decrease the money. She doesn't want to devote more money. So devote more financial, no. In the C was not talked about at all. So C, when they have not talked about C, obviously eliminated. Then we went upon to this question. We said she was saying artificial air is dry. Dry means it's low in moisture. So if something is low in moisture, that is dry. And the only word I focused, dilation. It did not talk about dilation. So I refrained. So that is what elimination. Dilation word was not spoken. And I eliminated this because artificial air is the heater. It cannot be low in temperature. It would be high in temperature. It's dry. So again, second question done. Let's go to the third question. That is what you need, yaar. Please understand the trick. If you do one listening nicely, you would be confident about your exam. Do one listening 3 times. Only 20 listenings will help you pass OET exam with A grade. I promise you. But you guys just keep on doing the next one, the next one, the next. You don't understand. Now you can ask me each and every word that has been spoken until now. I can tell you each and every word. Each and every word I have listened to very nicely. That is what practice does. I know in the exam you will get one shot, but that is how your subconscious mind adapts. Don't worry, in the paper you will be able to do in one shot only. I have done in the one shot. Even if I would not have listened to it again, I would have done B, I would have done B, or I would have done A and B even in one shot because I could see elimination. So now I want to focus on nosebleeds, maybe hypertension, organ failure, or allergy. And with allergy, they have given an extra word if discharge is present. So allergy alone will not help the answer. Discharge should also be present. So focus on each word. Let's see.
The evolution of an organ can take millions of years, in fact. The immediate cause of a nosebleed can be local trauma.
Cause. Immediate cause can be maybe. Now my grammar is also comes in action. I get more activated when maybe word or can be word is spoken because my question contains this word maybe. So let's listen to it again.
And cold environments. Now we all sit in heated rooms, and the nose hasn't adapted to this. The evolution of an organ can take millions of years, in fact. The immediate cause of a nosebleed can be local trauma or inflammation caused by a simple cold, but systemic diseases have to be ruled out in all adults presenting with the condition. People with chronic allergies in the nose are more prone to nosebleeds, and there are some other serious conditions that can.
So she talked about allergy, but she did not talk about discharge until now. She talked about allergy, but she did not talk about. Still, C is not my option until now. I will make you listen again.
But systemic diseases have to be ruled out in all adults presenting with the condition. People with chronic allergies in the nose are more prone to nosebleeds, and there are some other serious conditions that can present in this way, including cases where the kidney or the liver is no longer functioning as it should.
Kidney or liver no longer functioning. Organ failure, kidney or liver no longer working. Failure, they are talking about organ failure. Organ, kidney is an organ, liver is an organ.
Foreign bodies that enter the nose by some means can trigger nosebleeds, though these are more common in children than adults, and usually there'd be a foul discharge associated with the foreign body. But for a lot of the nosebleeds we see, about 30%, we can't find a specific cause.
Now, I want to know whether they have reached to, I want to know whether they have reached to question number 34th or not. Now the question is this much only. Whether they have reached to question now specific word. Specific means particular. So I think they have covered this question and now they have reached to this question. So the next question should always be in mind. So particular means specific. So I think when she is speaking the specific word, that is my, so you can help me with the question number 33. If my answer is right, then you can let me know. Question number 33.
B, sir.
Done, guys. Dekho, there is no cheating. I swear on anything in this word, I have not seen the answers. I'm telling you it's easy. I'm telling you the main reasons how to do it. And it's very simple. That is why I say OET ka reading and listenings are never difficult in this world. If you pay concentration, if you learn how to do it, and elimination is the method. You eliminate one option, you eliminate second, you become pro. Like even in this case, 33rd question, allergy word was spoken, but I have read the word discharge, but she did not talk about anything like discharge. How can I do C? Hypertension was not spoken at all. How can I do A? Means sometimes I might not listen to it, by chance I skip it, then it's okay, but at least you should know how to do it. So now 34th, and she would be talking about specific word.
Than adults, and usually there'd be a foul
And
discharge.
34th question is the most difficult one, but I always believe, and that is what I want to tell you guys. I always believe, and that is what I want to tell you guys, that when the questions are difficult, whenever the question would be difficult, the answer would be direct. So I told you that 34th question is a very big question and it was very hard for me to get the knack of it. But trust me, 34th question would be the direct and the easiest one. Let's try and listen to the statement. Let's see.
Associated with the foreign body. But for a lot of the nosebleeds we see, about 30%, we can't find a specific cause. A lot of people who are at the age where they
So
get
now I have the keywords like cause. I have the keyword specific. So now there are two keywords I have found in this question. Now I just need to know whether it is clinical shock, whether it is high blood pressure, or whether it is difficulty in finding specialist. What is the main cause of concern? What is the main cause of concern associated with the nosebleeds? That is what I want to know. Let's play it.
high blood pressure are prone to nosebleeds, but the blood pressure itself doesn't cause them. So when we see an adult,
So I think she's still over here. She's saying blood pressure, high blood pressure does not cause it. So this option is also eliminated if she's speaking 33rd until now. So she is saying blood pressure does not cause it. Let's listen to it again.
about 30%, we can't find a specific cause. A lot of people who are at the age where they get high blood pressure are prone to nosebleeds, but the blood pressure itself doesn't cause them. So when we
Blood pressure does not cause nosebleeds. So A option is also eliminated. Finally, done.
adult with a nosebleed, we have to consider the systemic cause, not just look at the event.
We have to consider the systemic cause. Systemic again is related to our whole body, related to blood, and that is what is the thing that she's again talking about bit of organ failure or something.
Itself. Now there's a pathway of care associated with nosebleeds. First of all, it's advisable to check whether or not a patient's in shock. A loss of at least 500 mils of blood is needed to get the early signs of shock, and it's rare to lose that amount during a common nosebleed. But if you ask any
So here is the key. She's saying it's rare. It's rare. Rare means very less. It's rare in the nosebleeds that you will have clinical shock. Again, B option is eliminated. This is what I say is elimination method. Let's listen to it again. She wants to know about the particular concern associated with nosebleeds. The particular concern is not clinical shock because it is very rare. Again, so B option again is ruled out or eliminated. Let's listen to it again.
way of care associated with nosebleeds. First of all, it's advisable to check whether or not a patient's in shock. A loss of at least 500 mils of blood is needed to get the early signs of shock, and it's rare to lose that amount during a common nosebleed. But if you ask,
It's rare. It's rare. So B should not be my answer. Let's see other options.
if my colleagues in ENT what they most hate dealing with, it's
What they most hate means particular concern. What they most hate dealing with should be my answer. Now she is about to reach to my answer.
Signs of shock, and it's rare to lose that amount during a common nosebleed. But if you ask any of my colleagues in ENT what they most hate dealing with, it's nosebleeds. This is because they tend to come in late at night. The patient's often scared.
They tend to come late at night, means nose bleeding patients come late at night. So that's one of the reasons.
And that sets their blood pressure off, making any further diagnosis and treatment problematic. So before you can do anything, you have to allay their fears. You might even give them a sedative to try to relax them. You also need to check they're not on any medication like aspirin or warfarin that might affect blood clotting. The next step is to try to
Okay.
patients.
So now this again I told you would be the most difficult questions. B is not my answer. I am confused between A and C. Now A and C has two specific points. High blood pressure is happening due to anxiety. C option says high blood pressure happening due to anxiety. If she has not related high blood pressure with the anxiety, then C option will be eliminated. Again, you have to read the option completely. High blood pressure due to anxiety. So if anxiety is not causing the high blood pressure, then it is eliminated. And if she is not talking about finding specialist support late at night, then this is eliminated. Let's listen to it again one more time.
It's advisable to check whether or not a patient's in shock. A loss of at least 500 mils of blood is needed to get the early signs of shock, and it's rare to lose that amount during a common nosebleed. But if you ask any of my colleagues in ENT what they most hate dealing with, it's nosebleeds. This is because they tend to come in late at night. The patient's often scared, and that sets their blood pressure off, making any further diagnosis and treatment problematic. So before you can do anything, you have to allay their fears. You might even give them a sedative to try to relax them. You also need to check they're not on any medication like aspirin or warfarin that might affect blood clotting. The next step is to try to find the precise source of the bleeding. The simplest way to stop it is to apply a silver nitrate.
So now she has reached to 35th question. That means 34th question has been done. And she has not talked about finding specialist support. As far as I think. So my answer reaches to C. It can be wrong, I'm not sure, but you can let me know whether my answer is right or wrong. Because she has not talked about difficulty in finding the specialist. She has not talked about clinical shock because she is saying clinical shock happens very rarely. So I don't think so. It is the main cause. The main thing she was saying was that it is important to allay the fears. Allay means ALLAY. Allay means reduce the fears. But again, you don't have to know each and every vocabulary to pass. You need to know clinical shock is rare, so it is not my answer, eliminated. Everybody can listen to it, right? Please respond. Everybody can listen to it. Everybody. Please, guys. Oh, I have not unmuted you. Yes. Please, guys, everybody knows B should
Yes, sir. Yes, sir.
B should not be my answer. Then A, she did not talk about finding specialists late at night. She said that the patient usually come late at night, but she was not saying that specialists are not available. So A should also be not my answer as far as I think. And she was talking about high blood pressure, anxieties, fears, so that I can take as an answer. 34th again should be C as per me.
Yes, sir.
All good? So
Yes, sir. Yes.
answer? Wow. So now you understand it is not difficult. And somebody was telling me that all my questions were wrong. Who was that who was saying all my questions were wrong? Who was that? Who made me do this listening? कौन था? Who was among you? Nobody now. Okay, फिर मैं किसके लिए कर रहा हूँ ये listening? Are you getting my point, guys? Did you learn? Komal ma'am,
Yes.
New Zealand, you were the one. Komal ma'am from New Zealand, you were the one who was asking me that part B was correct and part C was wrong. Now ma'am has slept. Ma'am must be sleeping now. Please, guys, it's not difficult. We just have to pay attention. So I have done 4 questions in front of you. I've told each and every reason. I've told about elimination method. I've told you each and everything how to do it. Have you all understood until now?
Yes, sir.
Everybody
Yes, sir.
understood?
Yes, sir.
So should we do the fifth question now? Should we do the fifth question now?
Yes, sir.
Yes, sir.
Okay, right. Done. So now 35th question is, what reservation does Dr. Davison express? Reservation means limitation. What is the reservation means? What is the limitation? What is the drawback about the silver nitrate pencils? Let's see what is the drawback. So I have to find a negative thing. Again, normally I say only word goes for elimination. But reservation, when I am trying to find something negative, then only word can be my answer. Because if I say that the problem with the problem with Apple iPhones also is that it has a one kind of a software. So only word is the one I can directly choose. But let's see what she says.
To that point. It's fairly atraumatic, but you can't get those chemical sticks to the back part of the nose. So they're mainly useful for children who tend to have fewer bleeds from that area than older people. Unfortunately, of the bleeding, the simplest way to stop it is to apply a silver nitrate stick to that point. It's fairly atraumatic, but you can't get those chemical sticks to the back part of the nose. So they're mainly useful for children who tend to have.
So they are mainly useful for children. They are mainly useful for children. So that means they cannot be used across wide range of patients. They are only useful for children. That means you cannot use with the wide range of patients. You cannot use it for the old patients. You cannot use it for other patients. So B can be my answer, what I have understood until now, but I'm not taking it as a final answer. I will listen to it again.
You also need to check they're not on any medication like aspirin or warfarin that might affect blood clotting. The next step is to try to find the precise source of the bleeding. The simplest way to stop it is to apply a silver nitrate stick to that point. It's fairly atraumatic, but you can't get those chemical sticks to the back part of the nose. So they're mainly useful for children who tend to have fewer bleeds from that area than older people. Unfortunately, what often happens when an older patient goes into an emergency department and there may be no ENT service available, as many such departments don't have them, what often happens is that because there's so much blood pouring out, the bleeding point can't be located. In this case, a gauze pack will be put into the nose.
So now she's talking about gauze packs. That means my 35th question is done. It should be B. You can help me and I will take your
Yes,
help.
sir. It is right.
How easy are, trust me, am I trying to fool you or are you understanding? It's very simple. Have I done any complicated thing?
No, sir.
Does the way I do writing,
No, sir.
does the way I do writing and speaking, why make complications? She did not talk about certain type of bleeds. She talked about that it can be used only for the children. That means you can't use it for the older people. You can't use it for the other people other than children. So you can't use for the wide range of patients. Simple, yaar. What's complicated in that? Now they are talking about the last question. What point does Dr. Davison make about the use of gauze packs? Let's do the last question and get it done.
Front and behind the nose to try to put pressure on the whole area and stop the bleeding that way. This can be very traumatic for the patient, and there's also a danger of secondary infection if it's left in too long. So the ideal management is to identify the bleeding point and stop the bleeding directly by cauterizing it or by ligation of the vessel. And this primary treatment will work 94% of cases. So before I go on to
Sorry, I did not listen to it. It was gone. Maybe.
patient, and there's also a danger of secondary
Sorry.
bleeding point can't be located. In this case, a gauze pack will be put
Yeah.
into
So
the
here
nose.
is my keyword. That is where I stopped. Now I'm listening. Gauze packs. So what is about the use of gauze packs?
Both in front and behind the nose to try to put pressure on the whole area and stop the bleeding that way. This can be very traumatic for the patient, and there's also a danger of secondary infection if it's left in too long. So maybe
they can cause harm, danger, and she is talking about secondary infection as well. So until now, C should be my answer, but I'm not sure because she has not talked about insertion, proper insertion. She has not talked about. She has said if it is left in place, that means she is talking about timing. That if it is left in place in the nose for too long, goes back. If left in the nose for too long, but she is not talking about proper insertion. But otherwise, yes, she is talking about danger. So half of the answer is correct, like this allergy wala, like this C allergy, but she did not talk about discharge. In this, she has not talked about in proper insertion. Let's listen to it again.
Try to put pressure on the whole area and stop the bleeding that way. This can be very traumatic for the patient, and there's also a danger of secondary infection if it's left in too long. So, the ideal management is to identify the bleeding point and stop the bleeding directly by cauterizing it or by ligation of the vessel. And this primary treatment will work 94% of cases. So,
This primary treatment will work 94% of the cases. So they are often an undesirable method of treatment. I think gauge packs normally are desirable method of treatment, 94%. They are often an undesirable. No, they are 94% desirable. They can prevent identification. There was a point she was saying that the ideal thing is to identify the bleeding point. Maybe use of gauge packs does not let us identify the bleeding point. This can be the answer, but I'm not sure. Again, but this is where you learn. When you are alone doing listening, don't do 12 questions. Do 6 questions if you have less time. Okay, sir, I'm working, I'm already in UK, I'm a healthcare giver, I don't have time. Guys, do only 6 questions, but do at least 5 correct. Don't do 12 questions. Why are you doing 12 questions when you don't have time? But repeat the same questions again. Learn. Learn how to do it. Speed will automatically come. You will start doing it in one time. I promise you. But at least learn how to do it. Once you know how to do it, then you would be able to do it even in one time. Because you will learn the method that what you are trying to eliminate. So C can be my answer, but she was not talking about proper insertion. I am listening to it the last time again.
fairly atraumatic, but you can't get those chemical sticks to the back part of the nose. So they're mainly useful for children who tend to have fewer bleeds from that area than older people. Unfortunately, what often happens when an older patient goes into an emergency department and there may be no ENT service available, as many such departments don't have them, what often happens is that because there's so much blood pouring out, the bleeding point can't be located.
Sorry, I have to take it forward.
If it's left in too long. So the idea put into the nose, both in what often happens is that because there's so much blood pouring out, the bleeding point can't be located. In this case, a gauze pack will be put into the nose, both.
Oh, sorry, she's saying bleeding point cannot be located. And these things, when the bleeding point is not located, then you can use the gauze pack. So B should not be my answer. Sorry, I'm taking my answer back. Let me check it for a second more.
Emergency department, and there may be no ENT service available, as many such departments don't have them. What often happens is that because there's so much blood pouring out, the bleeding point can't be located. In this case, a gauze pack will be put into the nose.
So if the bleeding point is not located, you will put the gauze pack into the nose.
In front and behind the nose to try to put pressure on the whole area and stop the bleeding that way. This can be very traumatic for the patient, and there's also a danger of secondary infection if it's left in too long.
Traumatic means they may cause harm, and this option has may as well. If they are not properly inserted, then they can cause harm. So it can be the answer because B, they are not talking about B. Sorry.
What often happens is that because there's so much blood pouring out, the bleeding point can't be located. In this case, a gauze pack will be put into the nose, both in front and behind the nose, to try to put pressure on the whole area and stop the bleeding that way. This can be very traumatic for the patient, and there's also a danger of secondary infection if it's left in too long. So the ideal management is to identify the bleeding point and stop the bleeding directly by cauterizing it or by ligation of the vessel. And this primary treatment will work 94% of cases. So
sorry, yaar. So B and C, this is what I am doing like you guys. I am trying to be correct. But if I use my elimination method, you will be surprised to know that I want to do my final answer as an A. Sorry, after a lot of thoughts, but I will still check out. It can be A or C. It cannot be B, but I will do A according to my elimination method. So please let me know what is the answer. Last question of the day.
Sir, A.
And now you will understand if I do not use my elimination method, I also do. Now I will tell you the reason. They can prevent identification. Nothing like that was spoken. The line that was spoken was that in some cases you are unable to identify the bleeding point. So you put the whole gauge back inside the nose, front and back, then you press it to stop the bleeding. But gauge bag is not preventing the identification of the point. When the point is not identified, then gauge pack is used. But gauge pack is not a problem in identification. So B option was eliminated by me at that point of time. So that is why I eliminated B option. When I came to C option, she said that this may lead to danger, this may cause harm if it is left there for too long. So she was talking about the timing. She was not talking about proper insertion. Again, I'm telling you. So this is elimination. And that is where you guys do wrong. That is where I said when I use your method, when I do not use my elimination method and I use your method, that at least C option is matching, I should do C. Then I would be wrong. If the C option is half matching, half is not matching, then it is eliminated. And then she said the last line that ligation and one more method she said is the best method, is the primary method and is used 94% of the times. So this is the method Gojpax which is not used 94% of the time. 94% of the times ligation method is used. So this is the method that is not desirable. Again, let's listen to it again the last time. And please listen to this video at least 10 times, yaar. This one video will help you pass listening OET test, I promise. But if you will listen to it once, you will not understand what I am speaking. There is no use of taking class, and there is no use of recording for my YouTubers as well. Why am I recording all this and taking my 57 important minutes out of my life and putting up so much energy on 6 questions? If I do it alone, I can do it in 5 minutes. I don't have to listen to it again because I understand elimination. In this case, when she was talking about financials, I would have dropped it down. Done. In this question, she was not talking about dilation. She was not talking about cold temperature. Artificial air is a heater air and it is dry in nature. So it is low in moisture. I could have done it like that. I'm taking time for you guys, yaar. Please learn. So give this video 5 takes, 10 takes, but learn this elimination. This will help you in reading. This will help you in listening. You find half the sentence correct. You listen to, oh, there is a danger. Danger means harm. Sir told might is also there. I will do this. But she's not talking out of proper insertion. She's saying if the gauge pack gauge pack may be dangerous, gauge pack may be dangerous if it is left in for too long. So she's talking about timing. She's not talking about insertion. So half the option is eliminated. That is what you need to learn. This is Dr. Bhupesh from Dr. BKM Institutes. Please subscribe our channel if you have not, for your own sake. If you don't like it, don't subscribe it. And our contact number is +917696734256. Thank you very much. And I hope you guys have learned a lot about listening because these days listening is creating havoc. And this havoc or this problem is not created by OET listening. This is created by our practice when we do not practice this elimination method. Reading is not a problem. Listening is not a problem, guys. It's we. We need to improve. So rather than taking a toll on OET, because we don't have that option. Even if I say bad about OET, it does not make sense because this is the only test that makes me the easiest of the nurse in the foreign countries. So rather than blaming it, I can focus on improving myself because it is under my control how to improve. So blaming is option for those people who do not want to improve. We all want to improve and we should work hard. And please try your best and learn this elimination method. I won't request you more because it's your life. You need to check it more rather than I do for you. Thank you.